Most people think their knee pain keeps coming back because they are getting old. But what if your knee is trying to tell you something your blood tests have been hinting at for years? How many times have you felt hopeful when starting treatment, only to feel disappointed a few weeks later when the pain returns? You rest, you take medicines, you try physiotherapy, maybe you even gather the courage for an injection. And then that familiar ache returns, that stiffness in the morning, that hesitation before the stairs, and slowly a thought appears. Is this just aging? Is this my new normal? Will I lose my independence? Before accepting that, we need to ask a different question. Is your knee failing or is your knee reacting? Over the years, I have noticed a consistent pattern in patients whose knee pain keeps returning. A slightly expanding waistline, borderline blood sugar, high triglycerides, low vitamin D, elevated uric acid. Nothing dramatic, nothing that makes you feel sick, but enough to slowly change the internal chemistry of the body. And your knee lives inside that chemistry. We are often told arthritis is wear and tear. That makes it sound inevitable, like your knees are simply wearing out because you used them. But your knee is not a bone tyre. It is living tissue. It responds, it adapts, it reacts. And living tissue is deeply influenced by the chemistry of your blood. If that chemistry changes, your pain patterns change. Think of your knee like a plant. If the leaves droop, you can support that. If the branch weakens, you can trim it. But if the soil is unhealthy, no matter what you do to the leaves, the plant struggles. In your body, the soil is your blood and your joint fluid. And this is where your daily routine enters the picture. In many homes, the day begins with foods we all love: idli, dosa, poha, paratha, rice-based meals, sometimes with that small bowl of curd and that spoon of pickle we all enjoy. There is nothing wrong with tradition. There is nothing bad about these foods. But if your body is already drifting toward a sugar imbalance, then repeated high carbohydrate meals create repeated blood sugar spikes. Insulin rises, falls, rises again the next day, and again and again. Not once, but daily, over years. And slowly, quietly, your blood chemistry shifts. And your knee lives in that chemistry. Many patients are surprised to learn their knee may be influenced more by daily metabolic stress than by how much they walk. Let me show you what repeated sugar spikes do inside the joint. 1. Inflammation. Sugar spikes increase inflammatory chemicals. These reach the knee and irritate the joint lining. The deep ache at night is inflammation, not weakness. 2. Hardening. Excess sugar attaches to cartilage. Over time, it becomes stiffer, less flexible. The same staircase now feels heavier. 3. Repair fatigue. Your knee repairs tiny damage every day. But when metabolism is unstable, repair slows down. It is like workers who arrive late and leave early. Damage accumulates. Pain persists. 4. Lubrication loss. Your knee needs smooth joint fluid. Metabolic imbalance irritates the lining. Lubrication reduces. Movement becomes less smooth. Pain increases. This is why some patients with mild X-ray findings have severe pain. X-rays show structure. They do not show chemistry. And chemistry strongly influences comfort. You're not imagining your pain, and you're not weak. Sometimes the explanation lies deeper. Here is what I want you to remember. This is not destiny. Metabolic contribution to knee pain can improve when blood sugar stabilizes, when triglycerides reduce, when vitamin D improves. when uric acid normalizes. Patients often notice better sleep, less swelling, more confidence, and most importantly, hope. When we improve the internal environment, the knee behaves differently. So the next question is this. If metabolism influences knee pain, how do we know when someone is biologically ready for advanced treatments? Are there specific markers, specific thresholds? In the next video, I will explain the metabolic criteria I use before recommending biologic therapy. Because timing matters and biology matters. If knee pain has made you feel discouraged, before assuming it is simply aging, look deeper. Sometimes the joint is not failing, it is reacting. When we change the environment, the story can change. I'll see you in the next discussion. I am Dr. A.K. Venkatachalam from the Madras Joint Rejuvenation Center.